you ever so much for inviting me. I think I'm going to learn a lot from this meeting. So it's a great pleasure to be here. There's a lot to talk about, and I think I might run out of time. I've, as usual, been very over-ambitious in what I want to tell you. So I hope that somebody's going to wave at me when I'm, getting to my last 2 minutes. Thank you. So I've been asked to talk about the state of the evidence on preventing and responding to child sexual abuse and sexual exploitation. The background to this research is that it seems to have been going on for a fair old time now. It's work that I've been doing that was commissioned by UNICEF, and the purpose behind it was to look at the research evidence on prevention and response to child sexual abuse and sexual exploitation, with a view to using that evidence to inform consolidated guidance on child sexual abuse and sexual exploitation. And so the guidance and the evidence review are pretty much completed, but not yet available. When they are available, then obviously we'll let you know. So the work was a desk-based review, and I've been asked to talk specifically about some of the findings on child sexual exploitation and to highlight some of the key messages from this review on child sexual exploitation. Now, I will try and address the issue of changing social norms, but I'm not too sure that I found a great deal in terms of the evidence that will help us in thinking. And I'm very glad to hear that people are thinking at the moment about conceptual frameworks and theory-driven approaches to looking at social norms and social change in this area. So just tell you briefly a little bit about what we did. I worked with colleagues from the University of Bedfordshire, Debbie Olnock and Tricia Hines, on the evidence review in particular. And the work was a desk-based review. I wouldn't describe it as a systematic review because, as you know, the literature in this area doesn't really lend itself to systematic review methods. But we did have rigorous methods for identifying the literature, and we had quality criteria for rating the nature of the research studies that we found. So there were basically two areas of literature that we looked at. There was the literature for the evidence review and the literature for the guidance, which I'm not going to talk about today, obviously. So the guidance review was looking at already published global guidance on responding to sexual abuse and sexual exploitation. For the evidence review, there were two components. There was a review of the literature on prevalence, impact, and also the nature of child sexual abuse and sexual exploitation. And there was also a review of the literature on effective responses. And in that area, we were looking at prevention and response. So looking at Laurie's public health model, it's looking across the range. So it is quite a wide-ranging review. And basically this slide just shows you where we searched and what we found. I won't read it to you. So the definitions that we used were based on human rights definitions. So they were taken from the Convention on the Rights of the Child, the two optional protocols, and also the Council of Europe Convention on Child Sexual Abuse and Sexual Exploitation. And I won't, again, go into the definitions in great detail because I know that you're going to be looking at this later. But our definition of sexual abuse was, as on this slide, it's engaging in sexual activities with a child who, according to the relevant provisions of national law, has not reached the legal age for sexual activities. This doesn't apply to consensual sexual activities between minors. And engaging in sexual activities with a child where use is made of coercion, force or threats, or abuse is made of a recognised position of trust, authority or influence over the child, including within the family, or abuse is made of a particularly vulnerable situation of the child, notably because of a mental or physical disability or a situation of dependence. And our definition of sexual exploitation is basically where somebody benefits monetarily or in some other way through sexual activity involving the child. And so if you look at the human rights conventions, they usually describe the types of sexual exploitation. This would include sexual solicitation and prostitution of children or adolescents. And it covers situations even where the child or another person doesn't actually get the money, so it's the promise of remuneration or some form of benefit that is the basic distinction between the two. Now, if you look at the data, I was asked to look very briefly at what we know about the prevalence of child sexual exploitation. Now, the prevalence literature for sexual abuse and sexual exploitation is pretty poor globally and incredibly difficult to compare. The data is improving because we've had a number of national violence against children surveys in different parts of the world recently. But if you look at child sexual exploitation, the data in that area is even poorer than it is for child sexual abuse. And it's obviously an area which is very difficult to measure for obvious reasons. A lot of the global VAC surveys haven't included questions on sexual exploitation. I was involved in the UK study and we didn't have a question on sexual exploitation. Some of the VAC surveys do have some questions that would be relevant for child sexual exploitation, and there may be some comparative data in those. But if we're thinking about child sexual abuse and sexual exploitation and what the prevalence data is telling us, it's very difficult because different definitions are used. So there's different definitions of a child, and there's different definitions of what we mean by the type of abuse that we're looking at. And this slide, in a way, sums up some of those variations in definitions, which is why comparison is absolutely hopeless. So a lot of the wider surveys look at sexual victimisation, as well as other types of sexual abuse and sexual exploitation. And sexual victimisation, in some of the studies across the world, the basic distinction is that they include peer-to-peer sexual abuse and sexual exploitation, which is why you get high figures. Then there are studies that look at child sexual abuse, and very often they define it in terms of the very conventional child protection approach to child sexual abuse, where they're looking at adult-to-child abuse. And then there are studies that include some questions on sexual exploitation as well. So comparison is difficult. What we can conclude is that most of these studies that exist show that child sexual exploitation is less prevalent than other forms of sexual abuse and sexual victimisation of children. And another thing that we can conclude is that very often different experiences of violence against children overlap and correspond, and that the risk increases if a child is sexually abused. They're more likely to be sexually exploited. So in terms of prevalence data, what this table does is that I've combined in this table, just to illustrate the difficulty of looking at prevalence, I have combined some of the findings from the Baltic Sea study of children's sexual health, and looking at the findings from the 5 countries that were included in that survey. So that was one of the few studies that actually asked about sexual exploitation. And that covered the countries of Estonia, Lithuania, Norway, Poland, and Sweden. And in this table as well are some of the findings from the national VAC surveys. So the VAC surveys from Cambodia, Kenya, Swaziland, and Tanzania. So our evidence review actually looked at the prevalence data across the world, but this table is just to illustrate for you some of the findings on sexual abuse and some of the findings on sexual exploitation across those countries. Yeah, I mean, there's lots of questions just looking at this data, and I thought this would surprise you. I mean, one thing that you'll notice actually is the very high rates of sexual abuse that we're seeing in the relatively high-income countries there. And one of the reasons for that is that the Baltic Sea study, when they asked children's responses, well, young people's responses, they asked about indecent touching. Whereas the VAC studies will ask on the whole about contact sexual abuse, including forced sex. And so the types of questions that we'll ask will influence the response that you get. We also know that how you ask it will have an influence. So for the child sexual exploitation questions, for the Baltic Sea study, they asked young people about whether they had ever sold sex. And that may explain why you get more boys saying that they have sold sex. I'm not sure. Whereas for the VAC studies, they tend to ask children and young people about whether or not anybody has offered to pay them for sexual intercourse or offered them food or some other favour. Some of them have looked at whether or not they wanted or expected a payment, but again, they're not all entirely the same. What we do see with some of this data is that the gender-based violence approach, although globally we know that girls are predominantly the victims of sexual abuse and sexual exploitation, there seem to be some anomalies in some countries where the gender-based differences seem to be smaller, and we need some further research to explore that. But we also need to, I think, if we're thinking about models, take into consideration what gender means in different contexts and also the developmental aspects of abuse of children, and how sometimes applying an adult view of gender-based violence to children's experiences may not entirely fit what's happening with child sexual abuse and sexual exploitation. What's happening with Poland, I'm not entirely sure. Talking to the people who did the survey, there were differences in how they asked and also the translation issues. And we do know that there are social desirability factors, what young people and adults will admit to in surveys, that will influence what's asked. We also know that the contextual things, surveys are a very blunt instrument for telling us about prevalence rates. And increasingly, what the VAC surveys are now doing is that they're including some qualitative elements, so you can get more of the context, which improves our understanding of what exactly is going on in some of these studies. What we can conclude, I think, is that it seems that levels of child sexual exploitation from the studies that we have, which are fairly limited, range between about 1% to 15%. For rates of sexual exploitation, but then of course you may well have area variations, and there are a number of issues to be taken into account, such as how that data is gathered, because most of the population-based surveys are household surveys, which wouldn't cover the children who might be being exploited necessarily. So what can we conclude about messages from this research literature on what works in terms of prevention and response? Now, I have to say something about the state of the literature and the state of the research, because looking at the research literature, a lot of the research literature that we have are single issue focused, intervention focused responses. And if we're looking at social change and changing social norms, then really what we're interested in is system change across those different levels. And there are very few studies, actually, that look at how you would measure change, taking into account those changes across all of those different levels of that socio-ecological model, which has already been highlighted in this meeting. So what we really need is that we need to, and I hope this meeting will develop it and help us in our thinking, a theoretically driven approach to evaluate change across those different levels of the system. And we tried to do some of that in the work with UNICEF. Something else I need to say about the evidence, which is a bit of a caveat, really, is that even if we look at some of the evidence on single interventions, so a classic example in the area of child protection is that people always talk about home visitation as being, one of the best evidenced approaches that we've got in high-income countries. But there are a huge number of challenges in terms of using the evidence that exists, even from single interventions. There's a huge research bias in the research literature to high-income countries. There's a huge lack of evidence from evaluation studies that actually look at outcomes. So if we're thinking about some of the work on social norms and changing behaviour and norms, in the prevention literature, we've got lots of stuff that looks at how you might change attitudes, or how you might, at the end of your evaluation, have people saying that they might do things differently. But we've got much less literature that actually tracks through and says, does that make a difference in terms of the prevalence rates of abuse and exploitation in those countries? So looking at the outcomes is a bit of a gap. There is a gap in terms of what works for whom, where, and in what circumstances. So that scale-up issue, we know all of this, don't we? Another big challenge that we found in trying to sift through the literature for our review was that this area of violence is incredibly fragmented. So we've got the stuff on violence against women and the stuff on violence against children, and somehow or other a lot of the stuff on sexual abuse and sexual exploitation sort of slips off. And so there's lots of different bits of literature where you have to sift through to try and find the stuff that's relevant. So the main areas that we found were the work on gender-based violence, where they talk about violence against women and girls usually, and so the sexual violence of boys up until recently didn't figure in a lot of the publications, and it does tend to be adolescent girls that are the focus in some of the gender-based violence research. There's a lot of research that's come out of the sexual health literature and HIV and reproductive health. There is some research looking at child sexual abuse, and mostly in high-income countries. We found less research on child sexual abuse in low to middle resource settings. There is some research on child sexual exploitation, but there's a gap in high-income countries on child sexual exploitation research, and that tends to be in low to middle-income countries. And the research literature on child protection, when you go to international congresses on child protection, and people say, well, we know these work for child protection, why don't we apply this? Home visitation. Can anybody tell me where the literature is on home visitation that will convince me that home visitation is a useful method of dealing with preventing child sexual abuse within the family or within known adults, or that it's a useful way of preventing child sexual exploitation? I don't think that we've got that evidence from that literature. So looking at the child protection stuff, the predominant focus of some of those studies are on this very restricted view of violence against children as parent or caregiver abuse to the child, which knocks out an awful lot of abuse. So we need to broaden our thinking and our conceptualisation of violence against children, which is a very promising thing, I think, which has been happening recently. Another area where I think we could learn is looking at the work on gender-based violence and violence against children, and including in those debates about intersectorial abuse, that aspect of developmental victimisation. So what happens across the life course, and putting that into context with gender and other forms of social exclusion. So we did have an evidence rating when we looked at the literature, and it ranged from tested effective, which were studies which we felt were replicable, rigorously evaluated using some form of experimental design. Hardly anything came into that category. right down to promising, pioneering, and also low evidence levels. So I can answer questions on that later, but most of the literature that we found was in the area of promising, was good, really, in terms of what we found. A lot of it could be described as pioneering. This is a table which summarises the overview of what we found. So if breaking it down into different areas of work, we broke it down into the work that was looking at creating an enabling national system, so looking at some of the structural factors which were discussed earlier, looking at primary prevention, and then looking at different areas of response, so identification and protection, and then the recovery and reintegration literature. And this is the range of evidence that I found existed in that area. So you can see that in the area of primary prevention is probably, we've got some of the best studies in terms of the experimental design studies. Very little, actually, in terms of national system responses, although we do a lot of it, talking about changing the law and child protection system building. Nobody actually knows what a good child protection system is, and we certainly don't in high-income countries. Identification and protection is the bread and butter stuff of child protection, but we still don't know whether it's helpful. And in some context, talking to child survivors of abuse, the child protection system response can be fundamentally unhelpful to them. And so our evidence in that area is actually very limited. We have a little bit more on recovery, maybe, in terms of the response literature. So just pull out some messages. So I guess the main issue in terms of the national actions was that I think what we observed from the literature is that there has been a welcome trend away from single issue focus in relation to violence against children, where the focus was on different types of violence. So there'd be work that's done on sexual exploitation, or work that's done on physical violence, or work that's done on trafficking. So there's a trend away from those single issues which lead to replication and lack of coordination, towards looking more at creating a more holistic approach to violence against children, and also a more system-focused approach to social change for violence against children. I think the child protection literature, unlike the feminist literature on gender-based violence, has never been particularly well theory-driven, and has always been sort of, this is what we do, let's test out what we're doing and try it out somewhere else. So it's lacked theoretical insight in many respects. The forces influencing social change obviously are very complex. We do know, probably in terms of national responses, we know a lot more about what doesn't work than we know about what does work. And so there are some messages that can be drawn out from our learning about what doesn't work. And some of the positive messages, I think, are that we know that poor coordination, lack of participation, lack of leadership, lack of resources, and lack of monitoring and also a disjointed approach are things that don't work. So it's safe to assume that if we rectify some of those, then we might get things done better. So, but having a more theory-driven approach and a better outcome focus for our work on child protection would be helpful. Case examples. Part of the work that we're doing on UNICEF was looking at, are there examples of where it looks as though promising national initiatives have been happening. And so one of the case examples that we drew out, and this is very illustrative, is the example of Tanzania, where they developed a violence against children survey, a very broad survey, in 2009, with a wide focus on lifetime and past year experiences of violence. And that included child sexual exploitation and FGM. To implement and to design the survey, they had a multi-sector task force, and the task force was involved in communicating and implementing the findings. One of the outcomes in the Tanzania example was a costed national action plan, as well as monitoring procedures, which are some of the flaws that we have in some of the national actions that have been developed. It's very easy to produce a plan, but much harder to actually do that in a participatory way, to cost it and to monitor it. And so some of the positive actions that have emerged from Tanzania are a commitment to expand child protection in local authorities, an expansion of training, development of police children's desks, improvements in safer schools, and also the set-up of a national child helpline. So some messages on primary prevention. What we found was that in relation to primary prevention for child sexual abuse and sexual exploitation, that we're starting to get some good findings in 3 areas of primary prevention. And we broke that down into the changing social norms area of work, work on situational prevention, and also work which is looking at tackling the structural disadvantages, so reducing risks and building resiliences. And in this area, there are some promising findings in relation to the changing social norms. So some of the work, particularly a lot of the work in high-income countries where they're looking at changing social norms, it's developed from work with perpetrators and sexual violence perpetrators, where the focus has been on changing the attitudes of perpetrators, and we don't actually know whether changing attitudes affects the behaviour necessarily. So there are a whole range of studies that have looked at working with perpetrators. A welcome change in recent years has been the focus away from just perpetrators to look at men and boys in the general population and how you change norms in the general population. And so there are some promising findings from things like the work on images, work that's developed out of Soul City's rollout, regional rollout, and Soul Buddies rollout, and some interesting findings in relation to sexual abuse in countries such as Namibia and Botswana. But again, if we're looking at outcomes, what that work is showing is that there are changes in the levels and the numbers of children who, having attended Soul Buddies or similar programs, changes in the number of children and young people who say that they would tell somebody if somebody touched them inappropriately. So again, in terms of our ultimate goal of social change and outcomes, the literature's not yet showing very much. Situational prevention, there's some interesting work happening in relation to in low resource settings camp design and regulating offender capacity to access children and sexually exploit children. And of course, from high-income countries, a massive amount of research, and particularly the UK, a massive amount of work on offender regulation. You don't see much of that perpetrator regulation work in low-resource settings, probably for reasons of cost. We're seeing some interesting work emerging from attacking the structural risks associated with child sexual abuse and sexual exploitation. And again, an example is the ELA project in Uganda, Bandiera's work, for education for life skills for adolescents. What they found from that work is that they tracked through 4,800 girls over a period of 2 years with a control and also an intervention sample. And they found that 72% of the girls who'd been on the programme were engaged in some form of income generation, and there was a decline in reported experiences of unwilling sexual experiences from 14% to 8%. So there are some promising findings from some of this literature. Looking at identification and protection, again, we know more about what's unhelpful, as I said earlier. There are some promising findings in relation to developing coordinated responses, so one-stop shop type models modelled on the barn house, the children's house approach in Scandinavia, and also increasingly some development of one-stop shop models in low-resource settings. But again, the evidence here is quite limited. What we know from that research is that that more children may use those resources, but again, very few of those studies have tracked through the experience of going through the child protection system once they've used those resources. We have information on multi-agency responses, which is fairly limited, I guess. But also some interesting work that's developing on community-based child protection resources and developing capacities in communities. So some examples that might be worth further exploration are the Families Matters programme, which is currently rolling out across low-resource settings, which is a programme which involves parents in helping children to negotiate safe and healthy relationships. And also another example are the ability of child helplines to mobilise change for better in low-resource settings and in actually high-income country settings. So an example is the work of the Romania Childline, where they've also done quite a lot of work on sexual abuse and trying to build capacity right at the level of schools up through to school councils and into government in Romania. There's a huge split in terms of the literature. In high-income countries, a lot of the focus is on individual and psychological recovery, whereas in low to middle-income countries, a lot of the focus has been on the reintegration aspects, particularly post-trafficking or post-sexual exploitation, where a child has been removed from the family and community. And again, the literature is not brilliant in this area. What you can observe in the literature is that there is a welcome shift in the literature away from rescue notions of intervention, more towards looking at the rehabilitative aspects of intervention responses. But again, the literature is quite limited. We know that they've had reintegration and repatriation models for trafficked children in a number of countries, and a lot of children's rights organisations emphasise and stress these elements of this work. But the evidence actually is very hard to come by in terms of what it means for children that have been reintegrated or repatriated in terms of their actual outcomes. The best evidence that we have in relation to recovery and reintegration is in relation to trauma-focused cognitive behavioural therapeutic interventions for child sexual abuse. And again, there are some interesting examples developing for recovery programs in places like Zambia, where they've been applying an apprenticeship model. So applying this approach in low-resource settings, which again might be quite helpful. So we need to do a fair amount of thinking, I think, in this area of recovery and reintegration. Okay, I hope I've not disappointed you, actually, because I knew I was going to stand here and say, well, this is what we did, but we didn't find out a great deal. We know that there is a lack of evidence. But I also know that there's a lot happening in lots of different settings, and I can't promise that we've mapped absolutely everything. But I also feel that a big message that we can take in terms of moving this forward is that lack of evidence isn't an excuse for inaction, and that what we need to be doing as a group of researchers is to be building that evidence in context. And I hope that that will be an outcome from this work. We do need responses across different levels, and we need to develop methodologies for actually mapping and monitoring social change, but bringing together some of the messages from gender-based violence with some of the messages on violence against children, so that we are actually able to map system change and changes in social norms and behaviour. So applying an outcome-based and children's rights focus to our research and also to the monitoring of some of the interventions that have developed would be helpful. And also developing a child-focused theory of change is something that we've been working on with UNICEF. So one that would integrate the developmental and the life course perspective into our understanding of gender-based violence. And also, actually, another thing that we need to be doing is challenging the deficit model. In that a lot of the research on violence has been looking at the harm and the damage done, and we've achieved a lot by focusing on that, particularly in the public health context. But what we haven't done so much of is looking at the flip side. So looking at, well, what is a non-violent and non-abusive relationship, and pulling out some of those messages on protection for children and for adults. Okay, that's it. Thank you.